Hi, my name is Alex Kent, and I'm applying to St. Kate's DNP program, specifically for the family practice cohort. During nursing school, I had the opportunity to work with a client who was diagnosed with Lewy body dementia. For 3 years, I assisted my client with activities of daily living through the progression of her disease into the hospice care and eventually with her passing. This job really opened up my passion for working with geriatric populations, as well as piqued an interest into the hospice care setting of nursing. After graduating college, I moved out to Denver, Colorado, where I worked on a progressive care unit at St. Luke's Presbyterian Hospital. Our patient population consisted mostly of liver and kidney failure patients, as well as neuroendocrine tumor resections. I worked preoperatively and postoperatively throughout the transplant and tumor resection process and really learned a lot about time management during my year and a half working there. After working at the progressive care unit, I moved on to work in the neurotrauma ICU at St. Anthony's Hospital in Lakewood, Colorado. Here, I work with a variety of patients ranging from motor vehicle accidents, physical assaults, penetrating traumas, traumatic brain injuries, and intracranial hemorrhages. I also work closely with the critical care, trauma, neurology, and neurosurgery teams to collaborate care and focus on care plans with my patients. Here, I have had to adjust my nursing care a lot from transferring from the PCU to the ICU, especially since critical care nurses are expected to think very critically and have a lot of autonomy when it comes to their patient care. I also work on the side at a surgery center called Focus Hand and Arm Surgery Center, where I work in the preoperative and postoperative units. My nursing experience thus far has really highlighted my passion for working with patients of all age ranges, even from the geriatric populations to the younger populations, hence my interest in studying family practice. I have also found that my experience has increased my desire to seek an advanced practice degree to expand my clinical experience as well as be able to provide a higher level of care to my patients. What motivates me to become a DNP prepared nurse practitioner? Though I have learned so much through my bedside nursing experience, I've always had an interest in advancing my degree. I thoroughly enjoy working closely with patients and their families, and I have found a lot of success when I care for patients holistically as well as medically when I really get to know them and understand them as a whole. With an advanced degree, I will definitely continue to foster these relationships with patients and their families, but also be able to provide a higher level of care than what I'm able to currently as a bedside nurse. What qualities about the St. Kate's mission and vision attract you to study there? Well, I am a Katie nurse. I graduated from St. Kate's in the spring of 2021. I feel that St. Kate's really prepared me to be a registered nurse with the skills that they provided and also the knowledge base. I felt like I was able to care for the patients medically as well as holistically. I really enjoyed the emphasis that St. Kate's put on focusing on a patient's mind, body, and spirit because it has allowed me to stay very centered in my practice and also has prepared me for caring for a variety of medical diagnoses. I've also always respected St. Kate's commitment to social justice. I feel like as an undergraduate nurse, my school really prepared me to be in contact with a lot of diverse perspectives and experiences that have allowed me to be a compassionate nurse as well as very inclusive in my practice. A few leadership roles that I am active in currently as a registered nurse is I partake in my unit's unit-based council. With the unit-based council, I participate in educating my unit on new protocols or new skills that we need to work on as a unit. And I also do a lot of research in quality improvements that can help us with our patient care. I also take a leadership role as a preceptor. I have precepted capstone students, new graduate nurses, and I've also helped train in experienced nurses to our unit. I feel like this has given me a hands-on role in welcoming new coworkers to the ICU. Describe strategies for being successful in graduate school. What learning style works best for me? I feel like in my undergraduate degree, I really got to perfect my studying habits. The best studying habit for me was to write out notes of presentations, textbook readings, and any other lectures that I was provided with in school. The ability for me to write out my notes and actually with the repetition has allowed me to remember it and then focus later on concepts and understanding the concepts and ideas as a whole. I've also taken that study strategy and I've used it with the NCLEX studying as well as for certifications with my registered nursing license. I also work really well in a team. During nursing school, I did a lot of studying with one or two different students or in a group setting. I feel like being able to talk through concepts and ideas and getting different perspectives on the learning really helps people look at all the concept ideas and really focus in on how each system works, etc. That is my application. I really am thankful for you guys considering me to be a part of the DNP program here at St. Kate's, and I'm excited to hopefully be a future student in the graduate program at St. Kate's Nursing School. Thank you.